Hello, good morning. My name is Kals Janamisi Kaimer from BSN 212F Group 22, and today I will be performing the newborn CPR. So, newborn resuscitation is designed to assist the baby in adjusting to life outside of the uterus. So, for the procedure, first is we are going to evaluate the newborn's transition to the extrauterine life using the Apgar score, because this scoring system provides a standardized assessment for infants after delivery. So, assuming that I had already done assessing the baby, and the Apgar score of the baby is 3, which is in critical condition, so we have to resuscitate the baby and do CPR. And then next is we are going to check for the responsiveness by tapping the shoulder, and by rubbing the soles and calling out the name of the baby loudly, because this will help to determine whether the newborn had some other reason for the event, or if they are indeed in cardiac or respiratory arrest. So, hey baby, are you okay? Hey baby, can you hear me? Hey baby, are you okay? Now, since there is no response, if there is no response to the position of the newborn, we have to position him or her in his back and call for help to activate the code blue, or do the doctor's quick, and then because the emergency codes help to notify the staff of an emergency situation, often without alerting the patients and the visitor to the crisis. Code blue. So next we have to do is to open the airway and suction if it is necessary, because suctioning is essential for the proper breathing. So we have to lift the chin while holding the head of the baby and then suction it. And then next is you have to, if there is a positive pressure ventilation, we are going to use the pediatric bag valve mask, or the BVM, if the patient is apneic or bradycardic. So we have to attach the BVM into the baby. So we have to attach the BVM to a oxygen cylinder with a 100% oxygen, and then we have to cover the entire mouth and the nose with the BVM in the infant. And since we just have improvised, so the mask has covered the interface of the baby. And then next is we are going to allow 30 seconds of ventilation, or 40 to 60 breaths per minute, and then look for the chest rise with each bagging, because this basic airways management technique allows for oxygenation and ventilation of the patients until a more definitive airways can be established. So let's start. 2-3 breath, 2-3 breath, 2-3 breath, 2-3 breath, 2-3 breath. So assuming that I have done it for 30 seconds, I can now have someone attached to the cardiac monitor and the pulse oximeter. So let's expose the bare chest of the baby and have someone help us with the monitoring of the cardiac. So if the heart rate of the baby is still below 60 after 30 seconds of doing the PPV, we have to do gentle chest compression. We have to use either our 2 to 3 fingers or 2 thumbs technique when doing the compression. And then we have to place compression fingers at the center of the chest, just below the nipple of the baby, and then press down approximately 1/3 the depth of the chest, about 1.5 inches. And then we have to observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2-man rescuer, because this compression helps us with keeping the blood flow throughout the body. So let's just first attach the valve mask. So our second rescuer will do the pressing on of the ambu-bag, and we are as the first rescuer, we are the one who will do the compression. So beginning compression, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay. So now after doing the compression for 4 cycles, we are going to evaluate the heart rate of the baby. If the heart rate is still below 60, we have to continue the chest compression and assist in intubation in giving the medication. And also however, if the heart rate is more than the 100, we have to proceed to doing the post-resuscitive care, because this will optimize ventilation and circulation, and also to will preserve the organ or tissue function, and also maintain the recommended blood glucose levels. So since upon checking in the cardiac monitor, the baby's heart rate is above the 100 beats per minute, so we don't need to resuscitate or do the chest compression, since the baby is in good condition already. So let's just cover the baby. And let us do the further assessment in order for us to evaluate the condition of the baby. And the next thing we are going to do is we are going to document the time, the procedures, assessment, and also the responses to the treatment that we have given to the baby, because documenting will serve as a legal requirement that shows that the nursing care has performed the needed interventions for the condition of the baby. So let me just remove my gloves and perform hand hygiene. And document the data that I have observed and I have done. So the time that I started my procedure is 12:15 and I have ended it. I have ended at 12:18 p.m. And the procedure that I have done is procedure, which is I have done it in a ratio of 3:1. And then the heart rate of the baby is 112 beats per minute, which is good. And the baby is already, as I can see, the baby is already responsive and also active. The body is turning pink, and there is already a strong cry. So that's conclude my return demonstration. Thank you.